Hello, everybody. It's Bill at Truth and Equity. And in today's video, I got really good news. I'm not going to talk about truth and equity, credit line banking, mortgages, or debt. I got something better for you today. I got a very special lady who's been in the medical and medical billing field for over 30 years. And if you have or anticipate having medical bills in the future, you want to know what this lady knows. She's just like Truth and Equity. She is the people's champion, but instead of the banking and borrowing side, she's on the medical billing side. So without further ado, let me introduce Kathy Ferguson of Medical Debt Resolutions. Hi, Kathy.
Hello, everyone. Bill, thank you for having me on today.
You bet. I was so excited when I met you with what you're doing because it's such a huge, huge problem all over the country. So thanks for joining us today. So real quick, why don't you tell everybody how, when, and why you started medical debt resolutions?
Well, I've got 30 years experience as a medical biller, medical billing auditor, medical billing investigator, and I've worked for companies. And previous company I had been an employee of, I found a just under a $2 million mistake with a national health insurance company. And they were not paying the company I worked for the proper amount. Plus, they were overcharging so many patients nationally. And I kept notifying the company and finally got them to listen to me. And then the accounting department came to me with a check for over $487,000. And my phone was ringing off the hook. Patients were getting refund checks. And I thought there's a serious problem for our consumers across the United States. And that is when I opened Medical Debt Resolutions. And I am a national company. I do this all across the United States.
Well, fantastic. I think you were telling me the other day that what's the amount of medical collections right now?
Yes, recently for 2023, $88 billion patients' medical bills in medical collections.
$88 billion.
$88 billion.
That's insane.
And my goal is to bring that down to 25,000 because chances are slim that patients even owe anywhere near that amount.
Well, and that's a good segue because you were telling me about something. It's that we all have healthcare rights. I don't think most people know what that is. I know I don't.
Healthcare protected information rights. That gives, you can always ask your healthcare providers, staff, facilities, health insurance companies. You ask questions. You make sure you get an answer that is totally understandable to you in a very timely manner. It cannot be swept under the rug. That is your right. You need to know. It needs to be understandable to you.
Yeah, and how often does
all
that
your
happen?
Questions.
Right? How often does their response make sense to any of us?
I know, and that's why it has to be a clear understanding to you. And you just kept saying, you just keep, this is your right. You deserve an answer. You have to have an answer that is totally understandable to you.
Now, you also talk about a financial savings signature. What is that?
Financial savings signature. When every healthcare provider, health facility, you are always asked to sign financial responsibility that you're going to accept whatever they bill you. And a huge money tip I give to everyone, when you are signing that, you sign it, the name of your health insurance company, coverages only. Because I see over 97% coding errors, financial mistakes where patients are overcharged, and majority of it is coding errors. Procedure code, diagnosis code, Dates of service wrong, demographics wrong, charges wrong, and not payable by the health insurance company.
So repeat that so everybody gets that again. So when you sign that financial responsibility form, how do you fill it out? How do you sign it?
The name of your health insurance company, coverages only, and your signature.
Well, that's interesting.
That's a big protection for you.
Because that forces them to go back to the insurance company.
Well, they
Instead
have
of
to
just
code it within
coming after
the
you.
health insurance. They have to code correctly, and they're sloppy in the coding. And then you're held financially responsible.
Then now
If they're
that kind of feeds into explanation of benefits, because I know you bring that up. So
and
how does somebody focus on that when they're reading all that documentation?
you can, your health plan, your explanation of benefits, all your healthcare information is online. So I suggest you create an account if you don't already have one. And you will always get a bill from the healthcare provider or facility first. You will get a notice from the health insurance company saying, we have received the bill, this is in process. And then you're going to see online or in the mail, you'll get the explanation of benefits showing you what was paid on your account. What you need to match with your health insurance card, your driver's license, all the demographics is correct. What you went in for, the procedure codes, how many are there and how many charge lines are there? I know that I'm kind of over, but look at the date of service. Is that the date you were in there? And is there a payment on every line? And when there is not a payment, that bill is sent back to the healthcare provider facilities saying make corrections and resubmit for payment. And I see so often patient is billed and not resubmitted or corrected.
Now, when it comes to all that documentation, right? I'm probably like everybody else. I get overwhelmed with that stuff. It's almost the same as my side of the world. Everybody just overwhelmed with all the documentation.
Well, of course, there's so much debt everywhere.
Yeah, well, and you need a lawyer to read what their lawyers put together. So when it comes to looking at all this documentation and explanation of benefits, etc., can people talk to their agent, or if they're in a group plan, is there an advocate? Who do they go talk to help them discern what they're looking at?
Well, medical debt resolutions is an expert. I can read and understand your healthcare plan, your concerns. I always say read online, because you're not, with a phone call, you're not going to get accurate information always.
But shouldn't the agent or there be an advocate? Shouldn't there be somebody, or is there somebody? Right? Again, I'm not trying to take people away from you, but
of course,
the general public, I mean, the agent that sold them the insurance, or the person that did the group plan, they're of no help.
No, they just sell the plan. But with your health insurance company, I tell everyone, you need to have a case manager. That's your one and only contact person with your health insurance. And they will know this, they will understand this and help you. And it's your one and only person. Ask for a case manager with your health insurance company.
Well, that's probably a good thing to do. If you're going in for some medical procedure, get that person set up right from the beginning.
Yes. And, look at your plan online. It's all, I know it's hard to understand for some people, but there's great information on reading your health plans. It's by categories. You're having surgery, look under what your surgery cost will be, what is covered.
All right, so that's all well and good if we know we're going to the hospital. What about emergency room stuff?
Yes, emergency room is a big deal. You need to be in the emergency room for a true emergency to have healthcare coverage. Oftentimes people will say, oh, I just got a another headache or whatever. And the health insurance doesn't always, there's over 10,000 health insurance companies across the United States. And every plan is different, but you got to protect yourself. You need to know that to have coverage for emergency room, it must be a true emergency. And they're like, I'm in New Mexico, and our health plans are in and out of network, which will make sense to some people across, probably many people across the country. But every emergency room must be paid in network. Doesn't matter if it's where you go, what your plan says. If it's a true emergency, it is covered under your in-network coverages with your health insurance company. I hope I'm clear on that.
Yeah, you are to me. But again, this is one of those subject matters. It's going to take more than just, a 15-minute video, because it is so complex, and, there's so many variables. So I'm sure after 30 years, you've got some pretty wild stories. Can you give us some examples of some cases that you worked on that were, pretty big and astounding, if you will?
Oh, absolutely. Recently, I resolved a $28,000 medical bill. Patient was in Montana, went into the emergency room with stomach pain. It was gallbladder. And they did all the tests. It was clear to the surgeon and the staff that this was gallbladder. Well, they went in and removed a piece of an attachment to the gallbladder. They did not remove the gallbladder. Patient was still in severe pain. The following day, they went in and removed the gallbladder. Well, health insurance denied, because health insurance does not pay for corrective surgeries, especially when it was black and white. This was gallbladder. And the insurance sent it back to the facility and said, make corrections and resubmit for payment. Well, they never did. They billed my patient $28,000. And his true responsibility was $840.
Wow. Now, why did it go in twice? It was, what did you say it was called? The second go around?
Well, I found it as surgeon's error. He knew this was gallbladder. The surgeon knew it was all the tests, everything was done, the location of the pain, it was gallbladder. And more money for the facility.
So you think they went in twice for the money? That's scary.
Yes. And I brought this to their attention, and I'm like, okay, I see that you do not understand numbers. So let's talk anatomy. And finally, they said, you are correct. And they removed the bill. They wrote off the $840 balance, patient responsibility, and they removed it from his credit report, giving him a zero balance.
Wow. And because he was working with you, because you were able to make that phone call for him.
Yes. And sorry, apologies. But I am in for the finish, and my expertise, I know what I'm looking for. I can read the doctor notes. I see what's going on.
Yeah, that's a beautiful thing. Any other stories come to mind?
I have a client that I spoke with yesterday, and the health insurance was supposed to be sending her an itemized bill. And you always ask for an itemized bill. Once you receive the explanation of benefits from the health insurance, ask for an itemized bill, and that is for the data service, the charges, all listed that you are being billed for. And her health insurance said, oh, we'll mail it to you. And asking so many questions, because she paid me for a consultation. And it appears that this facility never billed the health insurance company. They're billing her full amount. And that's against the law in every state. You have health insurance, whatever health insurance, it always has to be submitted for payment. Even if there's a denial, there has to be a document of why it was paid, why it was not paid.
Well, that kind of feeds into well, our healthcare rights. And I don't know, I don't think
Yes,
people are
always
well
ask
aware of those.
questions. It's important, always ask questions.
Well,
And you
if
make
people
sure
don't know
you
the
get
right,
an answer.
what if they don't know the right questions to ask? Are there certain questions that people should be asking that they don't?
There's a lot, because people don't ask questions till after they get this large medical bill. But, you know, be upfront. Sign your patient financial responsibility. Sign that correctly.
Yeah, that's really,
Understand your health plan a little bit. Read your health plan. Always match the explanation of benefits from your health insurance company. And not everyone has health insurance across the United States.
well, that's true.
But everyone can ask for financial assistance,
So
a financial discount.
can you help people without insurance? So if they, you know, have to go to
Yes.
the hospital, emergency room, what have you, and
Yes.
they had to do it on their own and they don't know what
Yes.
to do, you can help them as well?
Yes, because I investigate all of it.
So tell everyone what they should expect when working with you. If I get you on the phone and tell you my problem, what happens next?
I offer a free 15-minute consultation. I want to hear your story. I'll tell you what I do and how I do it. And this is across the US. And I can explain to you how you, I can explain to you how to fix this. Not in the 15 minutes, but I can explain to you how you can fix this, or you can hire medical debt resolutions to work for you.
So it's kind of case by case, just get the conversation started.
Yes.
So you
And
got
I
better.
educate, yes, and I educate patients all the time, because medical bills, $88 billion across the US, is absolutely ridiculous. Just because you got a bill does not mean you owe it.
Well, not to mention a good part of that 88 is, sounds like it could be fraudulent.
Yes. And I fight for the patient. I protect the patient. I turn facilities and providers into the medical board and have them run an investigation. And I'm human. I'm not perfect. I make mistakes, but chances are slim that there are mistakes in my findings.
I'll tell you what, this is why I wanted to have you on, because we are two peas in a pod. There's this
Absolutely.
the public is just getting raped and pillaged by the people we're supposed to trust, that have our back, and we spend good money for that trust.
Well, we do, and people, instead of paying their medical bills, they need to be involved in truth in equity. What a big money savings to everyone across the country. How we spend our money and not just assume, oh, I owe this.
Well,
This must be true.
I know we've helped a lot of people pay off hundreds of thousands of dollars.
Yes, absolutely. Bills. Every day.
Yeah,
yes.
Yeah.
It's
well, and
huge.
I'm telling you what, next person I run across has got that problem, you're the first phone call.
Thank you.
Before we do anything. Well, it's
yes.
You know, again, it's all about putting money back in people's pocket, you know, taking it away from those people that shouldn't have it and put it back in the pockets of those that should. So,
yes.
Well, I'll tell you what, what's the best way for people to reach you?
Yes, my phone number, 505-307-9350. And my email is MDR is in medical debt resolutions freedom @gmail.com. I have a website, medicaldebtresolutions.com. Yeah. I have, you can schedule an appointment with hihello.com. Medical Debt Resolutions is on there. I'd love to hear from people. I make a difference. just like you, truth in equity makes a big difference for consumers.
Well,
We offer a great need to so many people.
yep. And it's just, and really what we're bringing to the party for everybody is
Absolutely.
we've been in the belly of the dragon for 30 years.
Oh,
I've been in my
I
business
know.
the
Well, we
same.
believe and we trust.
Yeah, but we know how it's working on the inside, and that's what the
Yes.
public doesn't get to see. And I know that's why I do what I do.
Yeah.
Just need to know.
People
So
make too many assumptions.
yeah, they got to, knowledge and information insulates you in
Absolutely.
so many different ways. And there's
It's so important.
yeah, it really is. Well, I tell you
Especially
what,
in the
we
economy.
could probably talk here for another hour or so. We don't want to do that to everybody. So I'm going to say thank you very much, Kathy.
Thank
for,
you. I appreciate.
coming on. And
Yes.
hopefully everybody's paying attention. If you got any medical issues, medical bills, you got to talk to Kathy. So be good, Kathy.
Yes.
We'll talk to you soon. Thanks, everybody.
Thank you. Okay.